A few words about the reasons why Demodecosis problem has not been taken up by clinical medicine for over 32 years. First, no one clinician with whom I discussed the problem was not aware of clinical acarology issues. Second, most health officials and scientists did not realize that Demodecosis is an advanced infection is able to give a variety of clinical masks. They did not know the axiom. Any advanced infection, if it's not cured properly, is able to give a variety of manifestations and complications. Third, the most important thing, in due time, I did not enter any of the existing medical mafia groups. I think for the same reason, in April 1981, having listened to me, the director of the USSR Institute of Dermatovenerology, Professor Skripkin, agreed to joint studies, but later he refused in his letter. I am grateful to colleagues, friends, acquaintances for their feasible help. Enormous work had been done. Therefore, I express huge gratitude to engineers and the staff of Scientific Research Institute of the Regional Pathology, working in 1981-1983, to staff and nurses of Gastroenterology Department of the Republic Clinician Hospital, working in 1973 to 1980. Also to native relatives and all my friends. With feeling of profound gratitude, I want to list by name those who assisted in performance of this work. Among them, academician Atchabarov Bahiat Chabarovich, director of the Scientific Research Institution of Regional Pathology, academician Zeltser Mikhail Yefimovich, the director of Scientific Research Institute of Endocrinology, Professor Teleova Tanaskul Selimenovna, Scientific Research Institute of Ophthalmology, Professor Uldanov Vadim Galimovich, Scientific Research Institute of Ophthalmology, candidate of Medical Sciences Turabayev Abdibek Turabayevich, the chief of the Central Clinical Hospital, doctor of higher category Masheyeva Raisa Gabdulinovna, ophthalmologist of Polyclinic of the Central Clinical Hospital, doctor of higher category Kinenbayeva Mariam Kinenbayevna, the chief of Children's Polyclinic 2, Dulatova Gulnar Murzakipovna, dermatologist of Children's Polyclinic No. 2, Imirova, dermatologist of Polyclinic of Republic Academy, Dusikeyev Aman Dusikevich, Deputy Minister of Healthcare of Republic of Kazakhstan, Birtanov Amantai Birtanov, the chief of Polyclinic No. 4, Klebanov Yakov Arkadievich, the chief health officer of Health Ministry of Republic of Kazakhstan, Yakhantova Galina Ivanovna, manager of Office of Republican Clinical Hospital, Associate Professor Jean Turiev, Department of Parasitology of Zooveterinary Institute, Doctor of Biology Sciences Kusov Vladimir Nikolaevich, acarologist of Zoology Scientific Research Institute, Professor Doshanov, the Director of Scientific Research Institute of Zoology, Associate Professor Yusupova Tamara Yusupovna, Medical University named by Asfendiarov, Laboratory Dr. Solovyova Lilia, Harchenko Valentina Viktorovna, Professor Pak Ivan Timofeyevich, Academy of Science of Republic of Kazakhstan, Amirova Naila Nigmatovna, teacher of Training College, inhabitants of Kentau, Malikov Auspek Malikovich, the chief physician of Children's Medical Association, Kulakov, the patient engineer of CT Patient Department, the pediatricians of Kentau Children's Medical Association, working there in 1982-1983 years. Inhabitants of Astana, Mushin Zhanaidar Yermekovich, director of Multi-Profile Medical Center Miram, Lukyanis Vera Grigorievna, general director of Cetnamed, Lukyanis Viktor Grigorievich, director of Cetnamed. Foreign colleagues, Professor Azilitskovskaya Natalia Nikolaevna, Institute of Parasitology, named by Marcinovsky, Moscow. Professor Yekisenina Natalia Ivanovna, Institute of Nutrition, Moscow. Professor Плетнев Борис Дорофеевич, acarologist, Чебоксары. Professor Дубинина Елена Всеволодовна, acarologist, State Petersburg. Professor Криволуцкий Дмитрий Константинович, acarologist, Moscow. Вайде, Львов, Ukraine. Professor Michel Bertrand, President of the European Association of Acarologists, 2005-2008, French, Montpellier. Professor Christoph Solers, acarologist, Poland. Professor Peter Schausberger, President of EARAAC, 2009-2012, Austria, Wien. Professor Lebedeva Natalia, ornithologist, Russia. Professor Shatrov Andrei Borisovich, acarologist, State Petersburg. If you allowed, I want to repeat the additional recommendations for an absolute recovery from Demodecosis and acariasis. 1 or 2 times a day, in the morning and in the evening, to take a hygiene shower with a bath and soap, economic, tar, Sulsenov, green. Dry skin needs using soap with glycerin. After bath should be wiped with an iron towel. Dress clothes ironed from within and outside. Change bedding at least 2 times a week. Wash bed linen at 90-degree water. Bedding material has to be anti-allergenic. Vacuum and a mattress and bedside wall weekly. Wipe a bed from all directions once a week. Make careful cleaning once a week under a bed. To process outer clothing, anti-mite-borne sprays, and to shake up. Make general cleaning in the house once a month. Not to contain animals in the house. For domestic needs, to use usual detergents. Regularly to supervise correctness of implementation of recommendations in all places of staying, to observe requirements for their contents. The approximate scheme of disposal from Demodecosis and its clinical masks. Treatment of the basic and accompanying diseases agrees to the standard technique in medicine by control of your doctor. Careful elimination of a biotope, household and production situation from dust, mite-borne allergens. Scarification of skin and problem mucous membranes from mites. Duration of this period depends on extent of defeat of an organism, the mites, which definition in power to the clinical physician acarologist. From this stage and aftercare at the allergist immunologist for full clarification of a human body from mite-borne allergens. Observance of measures for prevention of a mite-borne reinfestation. Then rules for caring children for 100% prevention of an allergy. Children should be daily bathed in salt solution, alternating to poorly pink solution of potassium permanganate till 1 year. After bath, child should be wiped with an iron towel or a dipper. Clothes should be ironed within and outside. Children's bedding material has to be anti-allergic and should be changed daily. The water used to wash linen should be 90 degree. The person who is looking after kid has to observe personal hygiene carefully and change clothes daily. People with skin problems and an allergy not allowed carrying of the kid. Before feeding, wash a mammary gland of mother carefully. Make cleaning of the room every day. I recommend the list of publications recommended for reading. All information about this report is in site www.allergy.kz in English, in the page Site News. Thank you for your attention.